All right, let's dive into some pretty interesting stuff today. Inflammatory disorders of the heart and blood vessels.
Oh, yeah, it should be fun.
You sent me a bunch of medical textbook excerpts,
Uh-huh.
so I'm guessing you want to go deeper than WebMD this time
Definitely, yeah.
and really get into what can go wrong when inflammation hits the heart.
Exactly.
So let's say I'm in your office, worried about my heart.
Okay.
What's the most unexpected thing that would make you think, this could be rheumatic fever?
Well, let me paint you a picture.
Okay.
A patient comes in weeks after they thought they recovered from a simple strep throat.
Uh-huh.
Now they're having trouble controlling their movements, almost like they're dancing involuntarily.
Wait, so a sore throat can lead to dancing?
Well, not exactly dancing, more like jerky, involuntary movements.
Huh.
It's called Sydenham's chorea, and it's a rare but very real complication of rheumatic fever.
Okay, that sounds a little scary.
It is. It shows how even a minor infection can have a domino effect on the heart.
So how does this happen? How does strep throat turn into rheumatic fever?
Basically, the antibodies that our body makes to fight off the strep bacteria, they can mistakenly attack the heart tissues.
Oh, so it's like friendly fire from our own immune system.
Exactly.
And what happens to the heart during this friendly fire?
Well, the inflammation, it can affect all layers of the heart,
Oh, wow.
but it especially likes to target the valves.
Uh-huh.
Imagine scar tissue building up on those valves, making them stiff and leaky.
Oh, I see.
That messes up the smooth flow of blood and can cause all sorts of problems.
So a simple strep throat could end up changing the structure of my heart.
That's why early treatment is so important.
Yeah, makes sense.
If we knock out the strep bacteria quickly with antibiotics, we can drastically reduce the chances of those antibodies attacking the heart.
So those antibiotics are lifesavers in this case.
Absolutely. Before widespread antibiotic use, rheumatic fever was actually a leading cause of heart problems in young people.
Really?
Now it's much rarer thanks to early intervention.
That's amazing.
It really shows you how important it is to take even seemingly simple infections seriously.
Absolutely can't just brush them off, right? So we've talked about the immune system going a little haywire.
Yeah.
But what if the inflammation is caused by a direct microbial invasion, not just a misfire of the immune system?
That brings us to infective endocarditis,
Okay.
where bacteria often enter the bloodstream through routine procedures and attack the heart's inner lining.
You mean like a dental cleaning?
Not the cleaning itself, but during any procedure, there's a small chance of bacteria entering the bloodstream.
Uh-huh.
For most people, it's no big deal,
Right.
but for folks with pre-existing heart conditions, it can be risky.
Oh, that's unsettling.
Yeah, so if you have any heart issue, always inform your doctor before any procedures.
Now, if I came to you worried about my heart, what are some signs that would make you suspect infective endocarditis?
One thing we look for is something called Osler's nodes.
Okay.
Those are tender, reddish bumps on the fingertips.
So if those pop up after a dental appointment, that's a red flag.
It's a sign that something might be wrong.
I see.
And there are other signs too, like splinter hemorrhages under the nails, Janeway lesions on the palms and soles.
Wow, so even tiny things like that can be clues.
Those seemingly minor signs can point to a bigger problem,
Like what?
like pieces of infected heart tissue breaking off and traveling through the bloodstream.
Uh-oh.
We call those emboli.
And they can cause problems elsewhere.
They can lodge in other organs like the brain, lungs, kidneys, you name it.
Oh, so it's like a tiny time bomb ticking away.
Exactly.
You even included a YouTube link in the sources for this one.
Yeah, sometimes visuals really help people understand.
That's a good idea. I encourage everyone listening to check out that video after we're done here.
Definitely.
So we've covered how inflammation can affect the heart valves and inner lining.
Right.
But what happens when the actual heart muscle gets inflamed?
That's called myocarditis.
And what's that like?
It can feel a lot like a heart attack coming on, chest pain, fatigue, rapid heartbeat.
Oh, wow, that's scary.
But there's a twist. Unlike a heart attack, the pain often eases when the person sits up.
So even a regular cold or flu could potentially trigger this.
Yeah, viruses like Coxsackie virus and influenza are often the culprits.
Oh, right.
And more recently, we've even seen COVID-19 linked to myocarditis.
Wow, so inflammation can really pop up in unexpected places.
It sure can.
So what makes myocarditis so concerning? What are the risks?
Well, when the heart muscle is inflamed, it weakens, making it harder for it to pump blood effectively.
So like it's working harder but not accomplishing as much.
Exactly, and this can lead to heart failure, where the heart just can't keep up with the body's demands.
I see.
In some cases, it can even cause permanent damage, leading to cardiomyopathy.
So it's not just a temporary glitch, it can have lasting effects.
That's right.
Before we move on to cardiomyopathy, is there anything unique about the pain in myocarditis that might help someone tell it apart from a heart attack?
Yeah, good point. The pain in myocarditis is often described as sharp and stabbing, whereas in a heart attack, it tends to be more of a crushing and intense pain.
Good distinction.
Of course, any kind of chest pain should be taken seriously.
Oh, absolutely.
But knowing those subtle differences can be helpful for doctors.
Makes sense.
So it's always best to err on the side of caution and get checked out.
All right, let's talk cardiomyopathy.
Okay,
From what I understand, this is where the heart muscle's pumping ability is compromised.
you got it.
So can you paint a picture of what's actually happening in the heart with this condition?
Imagine blowing up a balloon too many times.
Uh-huh.
It gets stretched out, flimsy, and struggles to hold its shape.
Okay.
That's similar to what happens in dilated cardiomyopathy.
Which is?
The most common type, the heart's chambers become enlarged, making it less efficient at pumping blood.
So like it's working harder but not achieving as much.
Exactly.
And what causes this?
Lots of things, genetics, infections, toxins, even long-term high blood pressure.
Wow, so many possibilities.
They can all contribute to this weakening of the heart muscle.
It sounds like cardiomyopathy can be a bit of a chameleon, hiding in plain sight.
It can be tricky to spot.
So how can someone know if they might be at risk?
That's why regular checkups and listening to your body are so important.
Yeah, makes sense.
Symptoms can be subtle, things like fatigue, shortness of breath, swelling in the legs.
Okay, but those shouldn't be ignored.
Definitely not. The earlier we catch it, the better the chances of managing it and preventing further damage.
Right, we've covered a lot of ground.
Yeah, we have.
But there's one more layer of the heart we need to talk about, the pericardium.
Ah, yes.
What happens when inflammation hits this outer layer?
That's where pericarditis comes in.
And what's that like?
Imagine this. The sac surrounding your heart, the pericardium, starts to fill up with fluid,
Oh, no.
like a water balloon slowly inflating around your heart. This is called
no.
cardiac tamponade, and it's a life-threatening condition.
That sounds terrifying. Are there any warning signs?
Thankfully, yes. One is muffled heart sounds,
Hmm.
like someone turned down the volume on your heartbeat.
Okay.
You might also have low blood pressure because the heart is struggling to pump against all that fluid.
And finally,
You might see distended neck veins as the blood backs up.
those are some pretty clear signs that something is seriously wrong.
It can be quite dramatic. We call these three signs Beck's triad.
So if I experience any of these symptoms, it's straight to the EI, right?
Absolutely. Time is of the essence with cardiac tamponade.
Good to know you also included some information on pulsus paradoxus in the sources,
Yeah,
which I understand is another sign of tamponade.
that's right. Pulsus paradoxus is a drop in blood pressure that occurs when you inhale.
Interesting.
It's more subtle than Beck's triad, but still an important clue for diagnosis.
And you've included a link from Stanford Medicine so people can read more about it.
Yeah, check it out if you're interested.
Well, we've covered a lot in this first part of our deep dive.
We have...
From rheumatic fever to pericarditis, it's amazing how inflammation can manifest in so many ways.
It really is.
It's given me a lot to think about. I'm sure our listeners feel the same.
Hopefully.
But before we jump into inflammatory conditions affecting the blood vessels,
Okay,
let's pause here and let everyone absorb all this information.
sounds good.
We'll be back soon with more insights into the world of inflammation.
Looking forward to it.
Welcome back to our inflammatory deep dive. We've explored how inflammation can mess with different parts of the heart. Now let's zoom out and look at the blood vessels.
The whole network, yeah.
Because it doesn't just stop at the heart, right?
Nope. Inflammation can spread throughout the entire circulatory system.
Affecting arteries, veins, even those tiny capillaries.
It's a systemic issue.
And I'm guessing one of the big players here is atherosclerosis.
Oh, absolutely. The silent culprit behind so many heart attacks and strokes.
That's the one where plaque builds up inside the arteries, right?
Exactly. Imagine the lining of your arteries, the endothelium.
Okay.
It's like a smooth, pristine highway.
Nice. I like that analogy.
But things like high blood pressure, high cholesterol, smoking,
Oh.
they act like reckless drivers, damaging that smooth surface.
Creating potholes.
You got it. And just like a wound on your skin, the body rushes to repair the damage.
Okay.
Immune cells swarm the area, releasing chemicals.
And that attracts.
Other cells, including cholesterol.
So it's like debris piling up in those potholes,
Over time, that debris hardens into a plaque.
making the artery narrower.
And less flexible, imagine that smooth highway now riddled with speed bumps and lane closures.
Not good. So that restricts blood flow to vital organs, increasing the risk of heart attack, stroke.
Peripheral artery disease, you name it.
So it's like a chain reaction with some pretty serious consequences.
But here's the good news. We can fight back.
All right, I'm listening. How do we combat this inflammatory onslaught in our arteries?
Remember those healthy habits we talked about?
Eating right, exercising.
Those are our secret weapons.
Hoo-hoo.
A heart-healthy diet.
Filled with.
Colorful fruits, vegetables, whole grains, lean proteins.
So we're nourishing our arteries back to health.
And regular exercise is like sending in a traffic patrol. keeping things moving smoothly.
Okay, that makes sense.
And of course, quitting smoking is a must.
Like putting out a fire that's slowly burning away at your arteries.
Exactly.
It's amazing how those simple lifestyle changes can make such a difference.
They really can.
But what if those changes aren't enough? Are there medications that can help manage the inflammation?
There are. Anti-inflammatories can be helpful in certain situations.
Okay.
And there are other medications that target specific inflammatory pathways.
But those are usually for more serious cases.
Right, so we've talked about atherosclerosis.
Uh-huh.
You also mentioned vasculitis in the sources.
What is that exactly?
Vasculitis is more intense.
Okay.
Remember those reckless drivers?
Damaging the road.
Now imagine they're attacking the entire highway system.
So it's like a widespread attack on the circulatory system.
Exactly. Vasculitis is a group of disorders that cause inflammation and damage to blood vessels.
Arteries, veins, capillaries.
Any size, in any organ.
So the symptoms must vary a lot.
They do. They can be very diverse and often mimic other conditions.
Like what?
You might see general signs like fever, fatigue, weight loss, muscle aches, rashes.
Okay.
But depending on which blood vessels are affected, you could have numbness in the limbs, headaches, vision problems.
Wow, it really can be all over the map.
It can be a challenge to diagnose.
So how do doctors figure it out?
A thorough medical history, blood tests, imaging study
And treatment?
often involves medications to suppress the immune system.
Like,
Corticosteroids and other immunosuppressants. It's like calling in a peace treaty to stop the immune system from attacking its own blood vessels.
so we're calming down that overactive immune response.
Exactly, reducing inflammation, preventing further damage to those vital pathways.
Okay, so we've covered atherosclerosis, vasculitis, two ways inflammation can affect blood vessels.
Uh-huh.
Anything else about vasculitis that stands out?
One important thing is that it can affect people of all ages.
Right.
But certain types are more common in specific age groups.
Like,
Kawasaki disease, a type of vasculitis that affects young children,
I've heard of that.
it can have serious consequences if it's not treated quickly.
That's a good reminder that inflammation can strike at any age.
It sure can.
Now let's shift gears and talk about the blood itself.
Okay.
Can inflammation affect that too?
Absolutely. Remember those tiny cell fragments responsible for blood clotting, platelets?
Yeah.
Inflammation can trigger their destruction.
Leading to?
Thrombocytopenia, which means you don't have enough platelets.
So you're more prone to bleeding.
Exactly. A tiny cut that won't stop bleeding, even internal bleeding, that's the danger.
Wow, and what about red blood cells?
Inflammation can mess with those too, causing hemolytic anemia.
Which means
Those oxygen-carrying cells are destroyed prematurely.
it's amazing how inflammation can disrupt these fundamental components of our blood.
It shows you how far-reaching its effects can be.
Speaking of reaching far, we can't forget about the lymphatic system.
Oh, right. Often gets overlooked.
It plays such a vital role in immunity and overall health.
It does. It's like a dedicated sanitation crew, clearing out toxins and waste from the body.
A network of canals and filtration plants, keeping things clean and functioning.
And inflammation can really throw a wrench in that system.
How so?
Imagine those canals getting clogged up by inflammation.
Okay.
When tissues get inflamed, they swell, compressing nearby lymphatic vessels.
It's disrupting the flow of lymph.
Exactly. It's like a traffic jam in the lymphatic system.
So what happens then?
You can get a buildup of lymph in the tissues, leading to swelling, pain, even infection.
And this can cause...
Lymphedema, where the swelling, usually in the arms or legs, becomes a chronic problem.
So things like surgery or radiation can disrupt lymph flow and lead to lymphedema?
That's one of the most common causes.
And what about those swollen glands we get when we're sick?
That's lymphadenitis. The lymph nodes themselves are inflamed, usually from an infection.
They're working overtime to fight off invaders. And then there's lymphoma, a type of cancer that affects the lymphatic system.
A serious reminder of how important this often overlooked system is.
It really is. We've covered a lot in this part of our deep dive.
Blood vessels, blood components, the lymphatic system.
It's amazing how this seemingly simple process of inflammation can have such widespread effects.
It all comes back to that interconnectedness we were talking about.
What might seem like an isolated issue in one area
Can easily affect the whole system.
So paying attention to our bodies and seeking medical advice when something's not right is crucial.
Absolutely. Early detection and intervention can make all the difference.
Well, we've covered a lot of ground today,
We have.
but there's still more to explore,
Yeah, we need to talk about the implications of chronic inflammation.
and how it's linked to all sorts of chronic diseases.
Heart disease, cancer, Alzheimer's, the list goes on.
We'll delve into all of that in the final part of our deep dive.
It's going to be fascinating.
So stay tuned. Welcome back for the final part of our inflammatory deep dive. We've covered so much ground, from strep throat to clogged arteries, even that sanitation crew analogy for the lymphatic system.
It's pretty amazing, huh, how everything's connected.
It really is, and it makes me think about all those chronic diseases we hear about,
Yeah.
heart disease, cancer, even Alzheimer's.
Right.
Is there a connection between those and inflammation?
Definitely, a growing body of research suggests that chronic, low-grade inflammation is a major contributor to many chronic diseases.
So not the dramatic, acute inflammation we've been talking about,
Right.
but more of a persistent underlying issue.
Exactly. Remember how we talked about inflammation being the body's natural healing response?
Uh-huh.
Well, when that response gets stuck in the on position, it can start to damage healthy tissues and organs.
Setting the stage for chronic diseases.
That's the idea.
Can you give us some specific examples of how this works?
Sure, let's take heart disease. We already talked about how inflammation fuels atherosclerosis.
That plaque buildup in the arteries.
Right, but it goes beyond just plaque formation.
How so?
Chronic inflammation also makes those plaques unstable,
Meaning?
more likely to rupture and trigger a heart attack or stroke.
So it's like adding fuel to the fire.
Exactly. By addressing chronic inflammation, you're not just preventing plaque buildup.
You're making those plaques less dangerous, too.
Right, and the same principle applies to other conditions.
Like?
Type 2 diabetes, chronic inflammation interferes with the body's ability to use insulin effectively.
So inflammation can mess with our metabolism, too.
It can, and there's more. Chronic inflammation is also linked to certain types of cancer,
Okay.
where it can damage DNA, increasing the risk of mutations that lead to uncontrolled cell growth.
It's amazing, a little scary, too, how inflammation is involved in so many different diseases.
It's a reminder of how important it is to keep inflammation in check.
For sure. So how do we do that?
Well, remember those healthy habits we keep talking about?
Eating, right? Exercising, managing stress.
They're not just good for your heart or your waistline.
They're powerful anti-inflammatory tools.
Exactly. Those colorful fruits and veggies, regular exercise, managing stress, they all contribute to a less inflamed body.
And there are certain foods that are especially good at fighting inflammation.
Right. Think omega-3 fatty acids in fatty fish.
Okay.
Or the antioxidants in berries and green tea.
It's like we have a whole arsenal of anti-inflammatory weapons in our kitchens and gyms.
I like that analogy. And don't forget about stress management.
Right, because when we're stressed, our bodies release hormones that increase inflammation.
Exactly. So finding healthy ways to cope with stress.
Meditation, nature walks, spending time with loved ones.
It's all part of the anti-inflammatory toolkit.
Taking care of our mental and emotional well-being is just as important as the physical stuff.
Couldn't agree more.
This has been an incredible journey. We've learned so much.
We have.
From the heart to the blood vessels, even the lymphatic system.
And through it all, inflammation has been the recurring theme.
It really has. It's a powerful force in the body.
Capable of both healing and harm.
Understanding it helps us make better choices for our health.
That's the goal.
So as we wrap up, what's the most important message you want to leave our listeners with?
Inflammation is a double-edged sword. It's vital for our defense system, but when it's out of balance, it can cause a lot of problems.
Right.
The good news is we have the power to influence that balance.
Through.
Lifestyle choices, stress management, and working with our doctors to address any underlying conditions.
That's a powerful message. We've come a long way from strep throat to systemic inflammation, from heart valves to cancer.
It's been quite a ride.
And an enlightening one. I want to thank you for guiding us through this exploration of inflammation.
My pleasure.
To our listeners, remember to stay curious, stay informed, and take charge of your health.
And may your inflammation always be in balance.
Couldn't have said it better myself. Thanks for joining us on The Deep Dive.